Tiller from our Health Department Director. And good morning, Jason.
Good morning, gentlemen. Just waiting on Brad. He's pulling up the presentation right now. All right, so it's been about 3 weeks since our last update. Next slide, please. So since the 17th, starting as usual with the national update, there have been over 3 million new cases in the US and 35,000 new deaths in the United States. There we go. Next slide, please. Kansas is not doing much better. We've had 51,000 new cases, over 1,000 new hospitalizations, almost 600 new deaths, and in balance to that, we've also had 76,000 negative tests that have been performed. Next slide, please. In the county, though, we have had we are up to 2,921 total cases. That's a change of 1,100, almost 1,200 cases in the last 3 weeks. 1,925 are recovered, over 900 that are active. And unfortunately, in the last 3 weeks, we've also doubled the number of deaths in the county from COVID-19 since our first case at the end of March. We have about 30 different clusters that we are currently investigating, and they range anywhere from long-term care facilities to businesses to family gatherings to just pretty much the entire gambit. At this point, it really, I almost probably should say just Saline County as a cluster, since it is everywhere. Hospital has also seen a significant spike in the number of hospitalizations they have. Currently, they've got, as of yesterday, 34 inpatient with COVID at the hospital. And you can see there the latest numbers from KDHE's website as far as how many people we've had tested in the county, those that were negative, and then our monthly percent positive rate is 17.1. Next slide, please. As expected, this line is pretty dramatic in its increase. And you can kind of get an idea of the number of cases per day that have been pouring in from the multiple testing locations around the county. The next slide, please, will make this probably a little bit more relevant. You can see in October, we had about 400 cases. Last month, we had 3.5 times that many in 30 days. And we're already at now this month about the same amount that we had in October and the first week of December. Next slide, please. And, I hope I don't do this to as any type of shock or anything like that, but I think it really needs bearing out that we need to see what this kind of impact. So I've added in this now deaths per month. November has not been kind to Saline County, both in terms of cases, hospitalizations, and deaths. December is not looking much better to start with, and unfortunately, unless we see significant change in what everyone in this community is doing, which I have seen quite a bit of change now with lots of holiday things that have been either changed to drive-through types of events or to, have been canceled. But that line is probably not going to look much prettier on the next time. Next slide, please. You may have heard that there were some changes from the CDC and KDHE in relation to quarantine. CDC's options that they put out involved a 10-day with no testing or a 7-day with testing. And KDHE has adopted those changes, but then they left it up to individual counties whether to stay at a 14-day quarantine, adopt a 10-day quarantine, or a 7-day with testing, or all of the above, which you can imagine now has probably and is creating a little bit of confusion from county to county as far as what's happening with quarantine, especially in a county like this where we have lots of people that live and work across county lines. After consulting with our medical consultant and with the hospital and staff, we felt that the best measure to adopt from this was the 10-day quarantine with no symptom development. People still need to monitor themselves for that 14 days. The 7-day was not really best for Saline County, not only in terms of the additional stress on the system for everyone trying to test out at 7 days, but the requirement of a PCR test in order to be able to get out of that 7-day quarantine would still end up making most quarantines almost 10 days by the time that those results came back. 10 days was also an opportunity, as CDC had put it, to help reduce some of the burden on people and communities, and hopefully to increase compliance with the quarantine measures. Next slide. So with the testing, statewide testing that is going on, we have had some coordination taking place with a couple of the vendors. One of them is CRL and the other one is Well Health, for them to expand testing. Excuse me, and I have another meeting with the representative from CRL later today to finalize some details about how that is going to occur here in the county. And then once we have those details, we'll be posting all of that information for the community once it's known. Next slide. So the one thing that everybody wants to know about is, when is the vaccine going to be here? And unfortunately, my crystal ball still doesn't work. So at this point, the information that we have is mostly just the same as what has been published publicly, is that at some point here soon, Kansas will get a little over 20,000 doses. Remember that dose number is only for about half that number of people, since most of them require a 2-dose regimen to start with. Priority populations at this point are healthcare and long-term care facilities. We have registered as a provider, and again, once we have specific details about when and if and how, or I should say when and how, vaccine will become available here, and then how that is going to get out to the public, we'll be publishing that too along all of our media routes, so that we can get that widely distributed. Next slide. All right, it's Christmas time. It is supposed to be a joyous time of year, but it's also a risky time of year right now with COVID everywhere. This is the new campaign from the state, Stop the Spread of Kansas, or Stop the Spread Kansas. The link is down there. There's a lot more information, graphics, and so forth. But bottom line, wear your mask, wash your hands, social distance, and especially during this time right now, avoid large groups. Try to keep it at, your family size groups, your immediate family. If you do decide to travel, make sure that you're thinking through your travel plans, where you're going, what you can encounter along the way, and then really decide, is it probably the best idea right now to go to grandma's house, or do we set up Zoom or something like that, so we can be able to at least be able to see and spend that time, but not necessarily in that physical capacity during the holidays. Next slide. And in reference to the mask order, again, it only works if everyone does their part. I know I say this over and over again, and sometimes it probably feels monotonous, but it's true. If everybody is doing their part with all of the things that we talk about, then we can help break the cycle. And everybody needs to act like, you know, the potential for COVID is everywhere, because it is. So we need, you know, everybody needs to think about what they're doing, where they're going, especially as it's cold now, the indoor gatherings, you know, really shouldn't be happening. But you need to think through very carefully on whether that is probably the best idea right now, or more importantly, you know, if you feel that there's still some sort of gathering that needs to take place, then think outside the box about how it can be done safely. And that might include, you know, a whole lot of Zoom interactions like we are right now. But bottom line, if we're not all in this, which we're all a part of it, whether we want to be or not, it's impacting all of us. Then this is going to continue on for a while, and we need everybody's help to try and reduce the spread. With that, are there any questions?
All right, are there any commissioners who wish to respond to the Health Department? I've got a couple of responses here, Jason. I noticed in the paper last week that an individual here in town was having a tough time, so on and so forth, but they mentioned that they had COVID twice. Do we have any documentation of people that are getting it twice?
I would have to double check here in the county if that's happened, but I know that that has occurred. General consensus right now still, I believe, is that immunity from having the disease is still only around 90 days. I know I've seen some other reports talking about longer ones, but I haven't seen anything confirmed yet. So it is still possible after that time period for somebody else to get it a second time.
Okay, also last week's quarantine announcement regarding quarantine protocols and everything, is that not something that the county has to vote on, even though the directive came from the health department, or is that just a standalone?
That one is standalone from the local health officer under statute.
Okay.
It's my understanding.
Will we be releasing those cluster locations and so forth once they're determined?
I am working on trying to put something together by type. I just haven't been able to finalize that yet. Some of that is available on KDHE's website, but we've had so much coming in, I just haven't been able to fully get that put together so that it would be ready for today yet. Okay,
I understand. Because there are a lot of questions that come forward from the public, you know, as I see people, why? Which is not too many people right now because I stay at home. Okay, I mean, the proof's in the pudding here, people. I think the community in general has stepped up their efforts to wear masks and stay quarantine, you know, stay at home and lay low. There are still those 10% or whatever that number is that don't wish to abide by that, and people, you're putting everyone else at peril when you're not wearing a mask because it's spreading the virus. So